I'm John L. Cameron. I'm the William Stewart Halsted Professor Emeritus of Surgery at the Johns Hopkins Hospital. I came here in 1958 after graduating from Harvard. I went to medical school here, I trained here, I was on the faculty here, I was chairman of the department for 19 years, and so I've actually been here at Hopkins for 57 years. Most medical historians consider William Stewart Halsted to be the most innovative, important, and influential surgeon that this country has produced. So that alone would make his story an interesting story, but he struggled for much of his career under a physical and psychological handicap that makes his story, I think, even more interesting and perhaps even more current. He was born in 1852 in New York City to a very successful, prominent family. His father was the president and CEO of a successful import company. He was tutored at home as a youngster and then attended middle school and high school at Andover. He graduated in 1869 and then stayed at home for another year to be tutored before entering Yale in 1870, graduating in 1874. His career at Yale was very successful athletically and socially. He belonged to most of the clubs, societies, associations that he was eligible for, and as an athlete was really outstanding. He played shortstop on the baseball team, he wrestled, and he played an important role in the early beginnings of football, in that in 1873, he was captain of Yale's football team, the year that football was first played with 11 men on each team. And it was played at Yale in New Haven, Yale against 11 young men from Eton. Halsted was the captain. He scored the winning goal. So football as we know it today, the Super Bowl, Monday Night Football, it all goes back to Halsted in New Haven at Yale in 1873. He was not a very good student, and someone actually looked through all the libraries in New Haven after he graduated, and there was no evidence that he ever took out a single book from a library during his 4 years there. And he had a very average to maybe even poor scholastic record. He then went back to New York to home and entered the College of Physicians and Surgeons, which was not yet officially associated with Columbia, and there he became an outstanding, serious, interested student. After 2 years, a PNS was 3 years in length, but after 2 years he'd done so well that they allowed him to spend his third year as a house pupil, sort of a rotating intern at Bellevue. And at the end of that year, he participated in an essay contest with his colleagues from his year, and he won the prize, so he ended up as the top student in his class. He then spent the next year at New York Hospital, a hospital where his father was on the board of trustees, again as a house pupil, sort of a rotating intern. And after that year, there was no other training for someone who wanted to be a surgeon, as Dr. Halsted did. There was no official way that one could become a surgeon. You either had to learn on your own by going to Europe, or to associate yourself with somebody in this country who said they were a surgeon, who also had had no official training, and attend as an apprentice for a year or two. So Halsted went to Europe and spent 2 years there observing surgery in Europe. The epicenter of surgery was in Europe at that time. The modern era was just evolving, and he watched Billroth, Mikulitz, Brown, Volkmann, and others perform operative procedures, again in the early era of surgery, of the modern era of surgery. He then came home to the United States and to New York City and started in 1880 what is often referred to as his New York period, 1880 to 1886. He became a very busy, acclaimed surgeon, performing operative procedures that hadn't been performed before. He was an outstanding teacher. He was thought to be a very charismatic individual. He lived on 25th Street, just off of Madison, with a friend of his, a Dr. McBride. They entertained in their home filled with antiques and oriental rugs 2 or 3 nights a week, and he was leading a very active, successful lifestyle. Now that all began to change in 1884 when he read a report in a local publication called the Medical Record that described a ophthalmological meeting in Heidelberg where an ophthalmologist, Kohler, used cocaine to anesthetize the cornea of a patient and then excise the cornea without any apparent pain to the patient. Halsted immediately ordered from Parke Davis some cocaine and started a series of brilliant experiments on himself, on his partner, Hall, and on a series of medical students, and thereby developed local and regional anesthesia, one of his outstanding contributions. But unfortunately, they all became addicted. He was convinced by Welch, by his father and his brother, to enter the Butler Sanatorium. And for the next 2 years, he spent most of his time in that sanatorium. Halsted came to Baltimore in 1886 along with his best friend William H. Welch, who was being recruited to be the first chief of pathology at Hopkins. And he came really to continue his rehabilitation from his cocaine addiction and his switching to morphine. He started working in the research laboratories and made really one of the first of his very important contributions. He worked out the technique of doing a successful intestinal suture. When he was in Europe watching Bill Roth and others, about half of the intestinal anastomoses failed, leaked, and the patients developed peritonitis. But Halsted worked out a very successful mattress suture involving the submucosa of the intestine, which allowed the field of alimentary tract surgery really to continue. Then in 1889, when the hospital opened, Halsted eventually was made chief of surgery, and when the medical school opened in 1893, he was made the first chairman of the Department of Surgery, and he held those positions for the rest of his life for 33 years. During those 33 years, he made many, many contributions with surgical diseases, developing cures or treatments for surgical diseases, putting together, initiating many operative procedures. He developed one of the first successful operations for inguinal hernia, the first successful operation for breast cancer. He was the first surgeon in the world to successfully remove a periampullary tumor. He did some of the first common duct explorations in the country. He did many of the first endocrine operations in this country. He sort of put together, invented many orthopedic operations. He was very, very active in the field of developing operative procedures for surgical diseases. But that really was not his most important contribution. He made 2 other contributions that were even more important. Before 1846, October 16th, a good surgeon was a fast surgeon because the patients were awake, screaming and yelling, and if you were going to do an amputation or remove a bladder stone, you had to be fast because the patient was awake, screaming. In 1846, October 16th, ether anesthesia was introduced at the Massachusetts General Hospital. Now, amazingly, for decades afterwards, surgeons persisted on thinking that a good surgeon was a fast surgeon, and it wasn't until the 1880s, 1890s that Halsted said, wait a minute, the patient is asleep. Slow down, handle tissues gently, maintain careful hemostasis. That was the philosophy of safe surgery, and he was ridiculed for it. It took him 3 hours to do a mastectomy. The Mayo brothers, who took 15 minutes, came down to watch him do his mastectomy. And after spending 3 hours watching him, they left, and one said to the other, "It's the first time I've ever seen the lower half of an incision heal before the top half is closed. But by the end of Halsted's career, his philosophy had held the day. It's so intuitive today, Halsted's philosophy, the philosophy of safe surgery, that it hardly seems like a major contribution, but it was revolutionary back at that time. But perhaps his most important contribution was the introduction of surgical residency training. There was no training in the United States at that time before Hopkins Hospital opened in 1889. When the hospital opened, he constructed the first surgical residency training program in this country, and it allowed him to train young surgeons who would leave. Stephen Watts went to Virginia and started a training program there. George Hoyer went to the Midwest to Cincinnati, and then to the east to New York. Harvey Cushing to the northeast to Harvard. Emil Holman to the West Coast. They all established surgical residency training programs. And this obviously elevated the caliber of surgery in the United States, and I think is the most important contribution that a surgeon has made to the field of surgery in the United States. And it allowed the epicenter of surgery to switch from Europe to the United States before Halsted died. And there it has persisted.